Alrighty, welcome back to Salt City Counseling, everybody. Once again, my name's Scott Carter. I'm a licensed therapist here in the beautiful state of Utah. It is spring, and spring is amazing. I have come inside to make some content for you today. I hope everybody's doing well out there. I have a viewer question on this one. Great question. Appreciate people leaving good questions in the comment section. Thank you for wording it in a clear and concise manner so that I can respond to this in a good way. This is a good question. I like this question. This is sort of a sounds like a very very personal situation. And so the question is this, and I'm going to answer this question and give my take on it, and give my take on the situation. And the question is this, okay? What do you think about making a 13-year-old girl go to therapy who expresses suicidal ideation, has bulimia, and cuts? She doesn't want therapy. Okay, so I am going to. This is loaded. This is super duper loaded. I know. You might be thinking like, there's not much there. It's only two sentences, and yes, that is correct. It's only a couple of sentences. This is actually a very very loaded question for me. I'm going to break it down. I'm going to break all of this down for you and answer this question about whether or not about getting a 13-year-old girl into therapy who has these issues. And so before I get into that, let me get my housekeeping out of the way and we'll dive right into it, man. We're going to tackle this. This is a tough situation. This is a tough scenario. So yeah, if you're new here, I hope you will subscribe, man. I hope you will like and share and comment and put your questions in the comment section below. Or send me an email, scottc at saltcitycounseling.com. And yeah, you know what to do. Share the video, like the video, hit the notification bell. Go check out my series on healing narcissistic trauma. And let's see, what else? What am I missing? If you really like my content, please hit the tip jar, Cash App, Venmo, PayPal. All those links are in the description below. Got a new channel on the way. 10,000 Ronin is just going to be therapy content for young people like 25 and under-ish. So stay tuned for that. It's on its way. It's on its way. It's on the to-do list. I'm making self-care a priority for me right now, and work is very, very busy right now. Got a lot of people asking for help, and so, but it's on its way. It'll be here soon. Okay, let's answer this question. So first of all, I want to break down some of the details in this, okay? Just to repeat the question, what do you think about making a 13-year-old girl go to therapy who expresses suicidal ideation, has bulimia and cuts? She doesn't want therapy. Okay, so first of all, I kind of look. I always look at the age. 13 is actually a very tough age. I always generally think that 12 to 14-year-olds can be a very very tough age, especially boys. I find 12 to 14-year-old boys to be quite challenging a lot of the times. It depends on the kid. It can be a very, very challenging age. Not a lot of insight, a lot of fear, a lot of irrationality, struggling to put things together. The fact that she's this old and is having these issues kind of makes me wonder, like, what's going on with this kiddo. Um, Bulimia, right? There's an eating problem. Sometimes, a lot of time, an eating issue is a control issue. So is cutting. Cutting is also a control issue. And so this is probably a kiddo that probably feels like she has a lack of control in her life. So if it was me, I would immediately start looking at like, how can we give this kiddo a greater sense of control in her life? Maybe increase or give her more choices, give her more freedoms, give her more autonomy. And I see a lot of parents, by the way, they get really hung up on trust. Well, we don't trust them. We don't trust them. Doesn't mean you can't give them some choices. Doesn't mean you can't allow them to be autonomous. You don't need to trust your child to express love for them. But if she is having this going on, quite frankly, I would probably be asking, and without any other information on this kiddo, I would probably be asking, where's the parent? Which parent is which parent is controlling? There, I said it. I'm not trying to point fingers. I'm just trying to do, like, if I see a kid with those issues, in my mind, there may be a parent who's trying to control her, and if I had that kid in therapy, it's there might not be a ton that I can do for her without also taking these concerns to the parent and getting the parent to do something different as well. And so if I had this kiddo sitting in front of me, or if I had this kiddo coming to therapy, I'd be looking a lot at the parents. Now, what do I think about making her go to therapy? Now, I don't think we should make anybody go to therapy. Instead, and especially, I mean, especially people with like borderline personality disorder or addictions, people that have an addiction, have an addictive problem, like a drug situation, making them go to therapy doesn't work, folks. It's not effective. In fact, it usually works against them. It makes them treatment resistant. In fact, if you make anybody go to therapy. So if a kid is only there, in fact, I've had this conversation with many kiddos, many. And it has to do with finding their motivation, figuring out what they want. Because I personally believe I put a lot of weight or traction into the idea that kids want to be well, that kids actually want help, that kids actually want wellness. And I bank on that every time, and it pays off almost every single time for me. I would say 90% of the time, if I try to find what their motivation is. And because I think sometimes we treat kids like they don't care whether or not they're happy or they're well, and I think that's crazy. Of course they want to be well. So here's my thoughts on that. First of all, if you make someone go, there's not a good chance that they're going to benefit from it. If she doesn't want therapy, there's a good chance that she sees that as an additional attempts to control her. And the nature of the question, making her go, is almost a confirmation that she might see this as like more efforts to control her. And unfortunately, a lot of parents will take their kids to therapy because they want the therapist to join the parent side, to get more clout, to get more, to like, I don't know, muscle the kid into doing more. If a kid has, this kid obviously, to me, this says control issues. My business line keeps going off when I'm trying to record these videos. It's driving me crazy. Good problem to have, I guess, right? They look like, I think they're all scams, though. It's all scams. Anyways, so the nature of the question, making this kiddo go to therapy, stop. So immediately it's like, stop making this kid do stuff. She needs to regain a sense of control in her life. I mean, right off the bat, right? But what I do is I usually try to get some communication to the kid, like, hey, listen, why don't you just come once? And if you really hate it, you don't have to come back. And I usually bank on that. It usually goes really well for me because I like to build that efficacy. I like to find out why is that kid unhappy, and how can I help them be happy? How can I help them help themselves? And I rarely find kids that are not interested in that because therapists are not miracle workers. I am not Jesus. I don't just heal people because they're sitting in front of me. They have to be engaged. And so the trick is getting this kid to be engaged, right? So if you're in a power struggle with this kid and it's like, you're going to therapy and I'm going to make you, then that therapy, you're making the job hard for that therapist. What that kid needs is some empathy, needs some compassion. She needs people to understand that she's in pain. She's hurting. She needs adults to connect with her and be like, hey, I know you're struggling. I'm just trying to find the right answers for you to help you help yourself, right? And to me, a good therapist is not there to make a kid sit there for an hour. And unfortunately, a lot of therapists kind of do this, or they try to do this unsuccessfully. Frankly, and I'm not trying to sound arrogant, I've heard therapists over the years tell me the stories about how they sat there for an entire hour and a kid that said absolutely nothing. I've never had that happen, not once, ever. And maybe it's just because I don't try and make them do things. I don't try to make them change. I relate to them. I express empathy. I express compassion. I try to understand where they're coming from. I listen to them. And quite frankly, sometimes it comes with a healthy dose of throwing a parent or parents under the bus a little bit, where I go, hey, look, I'm sorry that your parents made you do something that you don't want to do. And then I try to come from the angle of like, most of the time they mean well. If they didn't love you, they wouldn't have brought you here. Or if the parent is sitting in the room, I've said this more times than I can count. I know that your parent loves you because he or she's sitting right there, right? Or both of them are sitting right there with you, right? If they didn't love you, You wouldn't be here, and they wouldn't be in this room with you. They mean well. They just don't know how to. They just don't know how to approach this issue. So to me, I wouldn't want to make this kid go to therapy, but I would ask her to sit down and talk to me, and let me listen to her. Let me listen to what she has to say. Let me listen to what she wants for herself. Why she's struggling. Where, if we can help her get well, if she wants that for herself. And most of them do. And for the most part, 90+% of the time, I get good results when I show the kid, like, hey, I'm not here to make you do something you don't want to do. That's not my jam. I don't do that. I don't even like it. I don't even like doing that. And I don't want a kid. I also know that if I make a kid be there that doesn't want to be there, they're going to become more treatment resistant. Future therapy is going to be relatively unsuccessful for them. So though that's kind of my take a lot on that. It really depends. Like with kids, with teenagers, you've got to stop doing this like I'm the adult and you're going to do what I say. I mean, I see too many adults. I see too many parents that treat teenagers like they're robots that are just supposed to do what they say. They're not. They're autonomous human beings. And if you don't treat them with that respect and realize like this kid will go to great lengths to defy you if they decide to. They will do immense harm to themselves in order to get that power back, or because they believe that it hurts you. And so you got to give them that respect that even though they're young and they don't know very much, you have to give them that respect. You have to treat them like a person. So that's kind of my take. Great question. And I know I was very direct in that video, but this is a tough situation and it needs directness. Okay? Thanks for watching, y'all. See you in the next one.